Hi, my name is Mariama Kabia, and I'm Senior Associate on the Youth Engagement Team at Women Deliver. I'm here in the Youth Zone, and you're about to see some clips from the WD 2019 Youth Zone, where young people shared their own stories of advocacy and creativity, where they're moving the needle for girls and women.
Okay, good afternoon, and welcome to the Women Deliver Zone. We at the Women Deliver, and on behalf of the Women Deliver 2019 conference, would like to respectfully acknowledge the lands of the Musqueam, Squamish, and as well as the Tsleil-Waututh people. We've got an incredible lineup of young leaders from around the world who are going to share their stories with us today, and they're going to share on their amazing creativity with us. They'll tell us how they've been making a huge impact and actually tackling serious issues facing young people back home in their respective countries. I'd like to start off by throwing out a challenge, not to just our speakers for today, but to you, the audience. I would like us to please think about how we can really shift the agenda, how we can move the needle for women and girls globally, and also how it is that women and girls can be at the forefront of global transformation. Just to briefly introduce myself to you today, my name is Juanita Mandela, and I'm a mother of 5. I come from South Africa, and I am an author and an activist. I established the Juanita Mandela Foundation back in 2012 with the aim of tackling social issues that are faced by so many of our children and so many of our people in developing countries like my home country, South Africa. I have first-hand experience of these social ills. Issues that are faced are issues such as road traffic injury and death, sexual and physical violence, addiction, and non-communicable diseases like breast cancer. I am the granddaughter of the late former president of South Africa, the late Nelson Rolihlahla Mandela, and the granddaughter of the legendary stalwart, the late Nomzamo Winifred Madikizela Mandela. Thank you. And as you know, my grandparents changed the history of South Africa as we know it. And they've really made such an impact on the world today. In many ways, I have been inspired by my grandparents, and they really are the driving force behind the work that I do. They and my family have given me so much hope, and especially throughout the very dark times of my life. I stand before you here today as a 2-time breast cancer survivor. I stand before you today as a survivor of sexual and physical abuse. I stand before you today as an alcoholic. I stand before you today as a survivor of depression and as a sex and drug addict. I suffered sexual violence as a young girl, and as I have briefly described in my book, When Hope Whispers, I was sexually abused by some of the adults that were meant to have been protecting me and loving me. I suffered at the hands of family members. I suffered at the hands of friends of the family, men and women too, who used their bodies against me like weapons. It was an abuse of power, and it was a violation of my trust and my love for them. It was a deep and traumatic humiliation that left me physically, emotionally, and mentally scarred. That in itself led to self-harm and to attempting to take my life on several occasions. It led to my alcohol, sexual, and drug dependency. My daughter, Zenani Mandela Jr., was a victim of another major preventable epidemic, an epidemic that is taking the lives of our children every day, and that is road traffic injury. My daughter was killed on a Johannesburg road back in 2010, and she had barely just turned 13 years old. My daughter would have been celebrating her 22nd birthday on this month, on the 9th. My daughter was killed by a drunk driver, and I was abused by adults. And in a way, for both of us, it was our leaders and it was our governments that also failed us. Globally, sexual violence, self-harm, and road traffic injury are the leading killers and health burdens faced by so many of our children and young people. They're all entirely preventable. Even though we live in a world that is so advanced in technology and a world that is advanced in innovation, we still fail to confront these epidemics that are entirely preventable. Our leaders around the world have committed to ending all forms of violence, abuse, and neglect. Neglect and violence and abuse on our young people and against women and girls by the year 2030. They have also committed to combat road traffic injury in the SDGs. We need far greater levels of commitment and we need far greater levels of action if we're going to get anywhere on this agenda. They are their true successors and they're fighting a new battle, and not just for us, but for our future generations.
There is a secret to ending stigma around contraception. It's creativity. When I embarked on my Global Health Corps Fellowship in Southwest Uganda, I thought I would learn about health talks as a way of addressing family planning. But the greatest lesson was that creativity and innovation is the key to smashing stigma around contraception, especially among the youth who might be missed through traditional methods. I will talk to you today about two women whose stories present the dichotomy that still exists when it comes to an unmet need for contraception, a gap that approximately 214 million women still suffer from due to lack of availability of contraceptive methods, lack of awareness, stigma, domestic violence, etc. So as I was supervising adolescent health and establishing youth-friendly services at a local health facility, I came across a young pregnant lady that was sobbing as she sought antenatal care. Fiona was only 15 years old and was impregnated by her own grandfather. She said, "I don't want that child. They made me quit school." In a country where abortion is illegal, Fiona was unaware of family planning and emergency contraception. The health system failed her. It bypassed her completely. As a result, she was not able to exercise her right to decide her own future. Another woman I have come across is Patience. Patience is a 19-year-old who wanted to delay having kids as she and her husband were starting a new business that would require basically their full attention. So after hearing about family planning from a women's empowerment group known as Dreams, she went to the facility and she received the services and the counseling that she needs, where she was then able to choose her method of preference. So what's the difference between these two stories? Unfortunately, Fiona not only had to suffer the mental health consequences of domestic violence, she was also a victim of an unmet need for contraception. Remember Patience? So Patience came to me a month later, interested to know more about the different types of contraceptive methods. So we taught her everything, from how to put a condom on a banana to knowing the difference between an IUD and an injectable. Later on, health workers at this facility started to notice a drastic increase in the number of youths coming to the facility and seeking family planning services. Young boys and girls, sex workers, it was amazing. So as it turns out, Patience was not quite that patient. Her vibrant nature triggered an urgency in her to rush into the community and share that information. How did she do it? She got creative. So, Patience and her husband's new business was a bar. For every drink she sold, she would offer condoms and make it a point to talk about family planning and demonstrate the use of these methods. She broke down misconceptions with her sense of humor, and she also engaged her husband to help her target the men that were reluctant to listen. By listening to her community and by being innovative, basically, Patience used a very effective approach that triggered her customers to go to the health facility and seek those services. Just like her, we can all tap into our creativity and human-centered thinking to design interventions that will work and bridge that gap. If we meet the global need for modern contraception, we will reduce the number of unintended pregnancies by 75%, induced abortions by 74%, and maternal deaths by 73%. Whether advocating for family planning at the hair salon or at a policy level, we can all go beyond the traditional methods of approaching this situation. So it's funny because Lebanon and Uganda, as different as they are, there are so many issues that are common across both countries. And in Uganda, I noticed that the systems and the interventions that we are using are not really taking into consideration the challenges and the obstacles that are facing these young women, whether the health facility is too far, whether we're not going very rural, whether the language that we're using is very difficult for them to understand. And I really think that if we use this concept of human-centered design and talk to our girls and adolescents and listen to what they have to say and let them come up with the intervention themselves, then this will be a very effective approach. Because we always think that if we impose what we know, then it's actually going to work, but context really matters. Listening to them and what they're going through really matters. So whether it's gender-based violence, which is very common, whether it's this unmet need, this gap of contraception. I don't want to have children yet. I'm not using anything as a contraceptive method to prevent it. You know, so I really feel like we need to actually listen, give them a sense of agency to come up with their own solutions because they are capable and they know what they need. You know, so yeah.
Absolutely. Thank you for that. I think, you know, the work that you're doing is truly inspirational. I love what you're doing with Dreams. Because not only are you teaching young people that they can still take control of their lives, but what you're saying to young people is there's hope and, you know, dreams are indeed a possibility. So my question to you is, why do you think it's so important to think outside of the box when it comes to sexual reproductive health and rights?
Yeah, which I guess I think because as long as we still have girls and women and youth and adolescents not receiving the services when it comes to sexual reproductive health, then there's so much more work to be done. Whether our approach is working, then we need to maybe do more. Whether our approach is not working, then we need to shift. So that's why I feel like if we keep on doing the same thing once and twice and 3 times, nothing is going to change. As long as we have this Fiona who is impregnated by her own grandfather, then there's something wrong. Either we are not targeting the grandfather or the men, basically. Or we are not targeting Fiona, maybe because she's 15 and we usually go for the older ones. So I feel like the fact that there are still people that are not being addressed or that are not receiving the services that they need, then we should definitely go out of our, take a step back, see what's going wrong, what are we doing, and what can we do better.
Let me just start with saying that I don't know if I belong to a youth zone anymore. So bear with me. That's what they say. Well, thank you. In Poland, where I come from, comprehensive sexuality education is not on the lawmaker table. Similar to other Central and Eastern European countries, sexuality education is practically non-existent. In 1999, wychowanie do życia w rodzinie, or what translates into preparation for family life, was introduced to Polish schools. This is a curriculum that reduces sexuality education to basic anatomical study of human body and promotes abstinence. Almost 20 years later, the opponents of the CSE in public schoolings still claim that comprehensive sexuality education would raise the number of illegal abortions, propagate sexual immorality, and promote sexual deviations. Regrettably, lack of CSE is a general trend that connects to other horrible things that are happening in Poland. For instance, medical providers can still deny contraceptives to women in Poland. After pill is only available with doctor's note. Abortion law is one of the tightest in Europe and in the world, and there are recurring attempts to punish the women who do so with jail. Comprehensive sexuality education is a right. We shouldn't have to ask for it. It shouldn't be debated. It shouldn't be used as an electoral token, pushed aside as political priorities change. It should be a given universal right to all, to learn about our bodies, explore our sexuality, and express our fears, anxieties, and needs. But it's not, is it? Through lack of CSE in schools, our sexuality continues to be shunned. Our needs and need to learn is being ignored, and our fears are being taken advantage of. Young people across countries and regions, and I'm sure in so many of yours, are asking questions that nobody is willing to answer. They seek help that nobody is willing to provide, and their sexuality is vilified and turned into taboos. And as activists, we are asked to drop it, aren't we? We are asked to wait for a more favorable political climate. We are waiting for a cultural change that is supposed to happen on its own. But teenagers in Poland and in your countries, they can't wait. They can't wait around for politicians to change their minds. They need reliable, judgment-free, and age-appropriate information now. So what do you do when there's no hope of change? What do you do when the need is pressing and urgent? When young people are out there are condemned to unreliable sources, shashed conversations, and fearful Google searches. Because of this pressing need for young people to access comprehensive sexuality education, I created a website with a database of questions about CSE. Something easy to create, update, and find online, and something so important that doesn't require permission from the government, from teachers, or from parents.
How would you like to see some of the work that you have done personally being further developed?
Well, I would like more people in Poland to join in, and any of you as well. I think we can really join together because the information is cross-regional. We don't have to hide in our silos. We don't have to do it in individual countries. We can do it together. Translate it, put it out there, find funding. Let's do it together. Let's be creative.
Beautiful. Thank you. Thank you.
So it took me 15 years to be able to say to you today, without shame, that I'm a survivor of childhood sexual abuse. I remember how I was groomed to stay silent about all the inappropriate touching and groping, how I froze each time I saw my abuser, who was a trusted family friend. I also remember the day I decided to fight for myself, to save myself. With all the strength that my 10-year-old arms could muster, I pushed my abuser away, flipped an old mattress over him, and ran to safety. He never came near me again. This personal experience has always compelled me to see myself in every news headline on sexual violence against adolescent girls in Nigeria. But in 2016, when I learned that 1 in every 4 Nigerian girls would be subjected to sexual violence before her 18th birthday, I knew it was time to take action. After extensive research, I could only find people speaking for or about girls. They were spoken of as victims without any consideration of their agency or their perspective on this burning issue. And to my disappointment, I could not find any sexual violence advocacy initiative in Nigeria that had adolescent girls' voices at the center of it. So adolescence is a critical time in a girl's life. It is when puberty hormones, media influences, and societal expectations reduce girls' confidence. And so considering that, the key question was, what approaches could ensure that Nigerian girls build the confidence that they need to take back their power? I came across an article by Martha Thompson, an American self-defense instructor and a professor emeritus of sociology and women's studies. Her article introduced me to the concept of empowering self-defense training, one that is not framed as a limited response to violence, but focuses on transforming internalized vulnerabilities, building self-confidence, and increasing self-acceptance among girls. This was a eureka moment for me. Under my organization, Girl Pride Circle in Nigeria, and with the support of a Women Deliver Young Leaders Seed Grant, my team launched the project Safe Kicks Initiative, Adolescent Girls Against Sexual Violence. This project uses empowering martial arts training and after-school education clubs to educate girls about sexual violence while building their self-defense skills and building their confidence to advocate in their communities. In basic taekwondo classes, the girls learn about the tenets and values of taekwondo, reactive movement, kicking and punching styles, and the ability to draw on their power from within in using strategic body parts as self-defense weapons. A day I would never forget is when one of our girls, 14-year-old Jemima, came up to me and said, after every self-defense class, after every taekwondo class, I feel like I can overcome any challenge I face in life. We have 95% of our girls who tell us that our training has enabled them build the confidence and the knowledge that they need to advocate in their communities. In 2017, we actually supported 270 of our girls to draft an unprecedented community action plan for the prevention of sexual violence in Alimosho, the largest local government in Lagos, Nigeria. This action plan was endorsed by the local government and distributed to over 1,500 community and religious leaders. Only last year, some of our girls also added their voices to our documentary, Echoes of Hope, where they strongly called on the Nigerian judiciary and law enforcement agents to accelerate justice for sexual violence survivors. This documentary remains a very compelling advocacy tool in our engagement with the Lagos State Police Command and relevant ministries and agencies. All these advocacy milestones tell us that our approach works. Slowly and surely, we are putting power back into girls' hands.